All right. Thank you for the organizers for giving me the opportunity to be one of the people who share with you the ideas. I'm kind of sad because being a person who puts his own money into healthcare, I feel very lonely in Estonia. So each and every year I get getting the invites and apologies for these people who have already heard my presentations, because I think that you know already what slides I'm gonna be showing and what my thing's gonna be. But I try to be brief. I try to go through this 120 slides in 15 minutes that I have, and then questions, of course. Who am I? I'm actually not a doctor. I'm graduated from the Tartu University Faculty of Economics, but I've been in healthcare and in healthcare-related areas since '99, so close to 20 years. As very many good things happen in life, this happened kind of by accident as well. When I was invited to write a business plan to a small spin-off company of Tartu University called Quatramed, it was, at that point of time, we didn't call it a startup. It was just a spin-off. We had 2 people working in the basement of Tartu University making molecular testing. And then it happened when I fell in love with the medicine and health tech. Because believe me, if you compare health tech to another areas like food processing or timber industry, where I have been involved as well, then the level of freedom or the level of possibilities to use different models and different technologies are much more and much better than in other industries. So I fell in love with the industry and I've been there since '99. During the journey I counted, I have made by now 29 acquisitions or sales of businesses or parts of businesses. So I've had a lot of experience here, and here is just the list of a couple of companies that I have been involved with. Looking at the healthcare, I think that we are in the beginning of the perfect storm, because you know all the insurance systems around the world or around the developed world, they are consuming too much money and they keep asking more and more. The societies are not able to finance it in the same sustainable way like they have been financing it during the period where the population was growing and the wealth was increasing. For example, in Estonia, the last 5 years, the average growth of the medical field has been 10% per year, but the GDP growth in general has been only 2 to 3. And it is clear that it cannot continue growing like this. Furthermore, the number of procedures or the number of operations performed by the hospitals and the clinical centers, taking into account this 10% increase of the costs, they have been on the same level for 5 years. And when we talk about life expectancy of the people, then during the same time, it has actually decreased. Not much, by half a year, but it has decreased. So I don't think that the solidar systems as such will survive. Clearly the process is not a fast one. It's going to take years and years. And from the other side, I see that the technology is providing more and more possibilities for us as healthy people, for us as sick people, for doctors, for the hospitals to start doing something differently. But the problem really is that the health systems are so strategic and politically charged in the society that actually no one dares to make any upside down or top down decisions. So, and my kind of $1 million questions that I would really like to discuss with you further on is that, would it be the small startups who will start or become so strong that they become kind of dominant players in the healthcare? Or will the incumbents, like the big hospitals and the clinics, start moving and using the technologies? And I don't have the answer. And if you look at the slides, then I have been on the both sides of the frontier. I've been investing into the existing business models, like Valitas, the biggest occupational health company, like Unimed, like Quatromed. These are the companies, the market leaders in some fields of the medicine who are providing the services each and every day. And I've been investing into the new business models, like the startups, who hold big promises. And I think that it's kind of really schizophrenic situation for me, because from one side, I see the everyday work of the doctor who sits by the desk, hopefully uses the computer, sometimes not. And from the other side, I see the deep neural language recognition models that promise to help anything or everything. And I'm not sure which one will prevail. So for me, it's kind of the situation of perfect storm. And just a comparison, I think healthcare is a little bit similar to banking system. Both are really heavily regulated. The incumbents or the prevailing companies are really big. And in the financial sector, you have seen that during the 5 to 15 years, the small companies like TransferWise, like PocoBay, like crowdsourcing platforms, they have been biting the little pieces off from the banking system. But they have not become kind of the prevailing system still. The big banks still prevail. So, interesting times. I think this is kind of my take-home message from 5 years. This is the period where I've been investing into early-stage health tech companies. And I now describe the ideal health tech startup. First, they have to know what they are doing from the technological point of view. These are the guys who have found or think that they have found something, and they think that it's going to change the world. Sometimes they just have some software. Sometimes they or you might have it connected with a device. It might be kind of a proprietary device. It might be any device that is connected or will be connected to your software. Recently, during the last 18 months, the artificial intelligence and the other buzzwords have come into the play. And this is kind of essential, what the startup should have. And when the startuppers come to me, this is where they concentrate their efforts. They try to explain what is the software, what is the hardware, how does it work, how promising the AI is behind it, and how they will solve all the problems that the big system has not been able to solve during the last 10 years or 15 years. But there is another kind of dimension or prism, and this is the medical excellence. And here I already see kind of the weaker results or combination of competencies. I would like to see here that the companies know what are the current gold standards of treating these people. And believe me, there are different gold standards. There are schools of professors and doctors who don't talk to each other, don't attend some conferences that the other party is organizing. So you kind of have to understand what is the patient journey and the doctor journey behind each and every model. Usually I see the slides where the market of diabetes or asthma or cardiovascular diseases is XYZ $100 billion trillion. and we're going to solve it. But very often what I see is that when you kind of start to slice the market or the use cases, you may easily end up that the real need is only in 10% of the cases or 5% of the cases. And even then, kind of the technology is only part of the solution, and I'll have the slide later on that. So I'd like to see the startup companies kind of coming a little bit inside out from the hospitals, knowing the medical need and the current gold standards. As I said, the gold standard is one thing, treatment model is another thing. What we saw in Quatromed 5 years ago, or a little bit more, 7 years ago, when we just expanded our activities from kind of the Estonian-speaking Estonian regions to Russian-speaking Estonian regions, that's not far from here. The family doctors should be kind of homogenic professionals who treat people simultaneously in one country, yes? No. The doctors in different cultural backgrounds act very differently. We, in 2010, 25, we found doctors treating in Estonia the patients the way that they were graduated in 80 or 75. So when we talk kind of the penetration of your solution into the medical community, you have to understand that there will be pioneers, key opinion leaders, perhaps 10% of the doctors who will start, yes, let's do it. Then there will be 40, 50, 60% of the doctors who will follow quite okay, but there will be certainly a part of doctors community that will be afraid of the new things, and they will do everything to keep that thing away from their practice. I don't know if there are any doctors here. I hope I didn't hurt you too much, but I think that there is kind of my kind of idea that doctors know everything and they do the best for me. I kind of got this confidence in 2001 when I started to talk with doctors who were supposed to buy the medical tests. Of course, if you have the hardware, then you have the certification, then you have the clinical trials, and this is very complicated. At least here we see that Europe is like one region and the US is another region, and we see some convergence there in the system. And if we talk about these two pillars, then these two pillars around the world are kind of universal. If the technology works in US, the technology works in Europe and works in Singapore and works probably in Africa. And the gold standards are more or less universal as well. If the person's body or organism is made up in a one way in Asia, it's probably made up the same way in Europe, in other words. But now comes kind of the most complicated things, part of the health tech startup and health tech startup. Even if you have the best system in the world, and even if the doctor wants to use it, then you face the insurance companies, then you face the hospitals, and believe me, the interests of the hospitals are not the interests of the doctors. Then you face the pharmaceutical companies or the device manufacturers with whom perhaps you need to integrate your solution. And then you have to kind of understand the need of the patient, the family, the employer, and someone else. And I think that I have not seen too many startups who have mastered all these kind of three areas. But you have to have this. Otherwise, you are not able to sell your product. And even if you know how this works in Estonia or Finland, it doesn't mean that it works in UK or US or somewhere else. And in the US, even if it works in one insurance company system, it doesn't work in another. By the way, do you know how many health insurance companies there are in US with federal license? Just guess. Wild guess. Anybody else? 1,100. So even if you are, and of course there are kind of the big ones and the smaller ones, but even if you kind of know the system of one insurance system, that might be kind of the big one, it's only the fraction of the US market. And the last thing that I want to see, tada, is the team who understands everything this. Clearly, this never happens, and we understand that we are not working in the ideal world, so we have to make compromises. But I want to see in the startup team kind of the elements what might take us there. Clearly, we are not able to develop all these competencies in one company, and that's why we need to have clusters like this, and then we have to have the incubators of the device companies where the startups can go, and then so on and so on and so on. But this is the complexity of the health tech startup for me. And again, as I see that the health tech companies are coming very much from the technological dimension, because it's the easiest to make kind of the mock-up of your software or the prototype of your hardware or kind of the first very robust AI model. And the other things are kind of lagging behind. This is an interesting concept that was developed some 20 years ago by European scientists. And it actually says that the innovation in technology is useless until you have the system or the framework where to start using this. And this is the kind of the external and the internal parameters of any company or any organization. It has to handle the technology. If you change the technology, then the culture changes, people changes, the processes changes, so on and so on. And then you have the relational capital, organization capital, everything. And the technology is just one part of it. I give you a very kind of example from another field. If you are digging a hole, and you are digging a hole with kind of the spade, then, and there are two people, then think about what do you value in the people, what are the processes in the process, and what is the culture of the organization. You just have to have kind of the big muscles and everything. The next part is when you start digging the hole with the excavator, and you just have to kind of pull the joystick handles. Then you don't have to have big muscles in the organization. You have to have someone who is kind of managing the person. All these people, culture, processes change. And if you now take the extreme example, that you have the robot who is digging the hole, then again, these elements that were important in the first or second example are not valid anymore. You need absolutely different people in the organization. And now if a startup comes to me and says that I have this kind of technological solution that's going to change the complexity of the previous slide, then the thing that they have developed has to be so huge that people who are afraid of change will start believing it and follow it. It doesn't happen too often. Certainly, I'm taking everything this to extreme, just to provoke your thinking about it. It says that actually the same research says 70% of the innovation does not fail because the technology doesn't work, but it fails because kind of the things fail between the people and between the organizations. There are obstacles and there are things what prevents the technology to be absorbed. When a startup comes to me, then I would like to see that they pinpoint what is the station they're in currently and where do they want to go. I'm here, I want to go here. And I mean, I need so much money or fuel for my train. And how much money is needed, again, depends on these three pillars that I talked. And when the company is kind of asking too much money or too little money to take the train from here to here, then it's kind of a problem for me. I think there is kind of no objective truth where one should go, because in different you have different solutions to the same problem. So it doesn't have the right answer that you are here and have to be there. But you have to kind of estimate the fuel you need, because if you take too much fuel, then the train is too heavy, and your competitors will move faster. And when you reach there, there is kind of no market anymore. And if you ask too little fuel, then I must say that people like me, these who invest, they are kind of, the fuel for the last stop is very expensive. So try to kind of think what is really needed to reach you there. And I don't even actually hope that if you say that you want to reach here, that you come up here. It's okay if you come here in a region, but you shouldn't come up somewhere here or here, then it's kind of a problem. And the same thing in a little bit in another way to say is that this is the linear startup model that I think you know by heart. You have the idea and then you start your thing up, and here you have the 4 Fs who finance you, and here you have the angels, and here you have the kind of the VC funds. But in the healthcare, I haven't seen very many of these linear models. What I have seen instead is actually that if this is the monthly burn and this is the time, then you should have kind of the core team who is ready to put their sweat money in, and then you make some sprints. And actually, when the companies come to ask the money from me, I don't believe that the first sprint will take you to the right station. So what usually happens is that, and if I now put the revenues here, then I think that something this happens. Hopefully this. And this is okay. Once again, I like very much what I'm doing, and I hope that that you like it too. So thank you, and if you have any questions, then shoot.
Thank you. We do have one question over here, which is upvoted by 4 people. So, and here it goes. Why so few investors in healthcare in Estonia?
I think the main problem is that we have one payer healthcare system. And the one payer who you know very well is the Estonian Health Insurance Fund. They don't act like insurance company. So they don't act like they should. They don't care about minimizing the losses. They are currently putting their effort of controlling the costs of already happened damage. There is almost no possibility for startup to pilot here in the home market. And in home market, why you need to pilot here is that the cultural boundaries between you and the hospital are lower, because you may have worked together, or you may have been in school together, or you may be neighbors. It's very expensive to pilot your thing in the other part of the world, or in the other side of the world. And if there is no pipeline, there is no investors. I think this is kind of the thing. What I really hope is that now the legislational change that took place earlier this year, that companies can use up to 400 euros per employee per year to health checks and health-related insurance costs. I think that this eventually ends up in a situation that we will have another 1, 2, or 3 reasonable buyers of the services of the startups or the service providers. Because currently there is no other buyer than the health insurance fund. And you know that in order to have the possibility to get your service listed in 2020 price list, you have to submit the application by end of September 2018. And me as an investor, I'm not ready to finance this 2-year lag.
Thank you. Anyone has any other questions? Yes, the microphone.
Good presentation. Thank you, Erki. I think maybe not commented too much here today, and in Estonian context is IP and intellectual property. Can you elaborate a little bit on that, all the way starting from the freedom to operate all the way down to the filing the patent, which is actually not the easiest route?
I have a couple of comments here. When Quatromed was born in 1999, we actually took use of the freedom that the patents filed by Roche in early 90s in the world were not valid in Estonia because we joined PCT, that is the Patent Treaty Cooperation in 92, with exemption. So that the patents that were not submitted before 1st of August 92 did not happen here. They were not valid in Estonia. So what we actually did is we copied the technology and started to provide services, and it was fully legal. This is my first comment. My second comment is that for me the IP is relevant in these early stages only from the point of view of the arrangement between the founders and the company, and potentially with the university and the company where these founders may have been worked with, or where the IP may be generated earlier. I haven't seen any startup failing because they didn't manage to control their IP, at least in this part of the world. If somebody knows these examples, it would be really nice to discuss these things. I don't want to say that IP is irrelevant. Clearly, you have to have your hygiene in place. The founders have to be given their IP rights to the company, and the relationship between the company and the university or company and the hospital should be in place. But I haven't seen that this has been kind of the problem where the failures start.
Thank you. Any other comments or questions?
So
no.
I have.
But I have.
Please criticize this picture. Tell me that I'm wrong. I'm desperate.
Seemed pretty right to me. I'm not from the sector, but it made sense. Yeah.
The word passion's missing off of that for me. Not in a naughty, wear socks sort of, English reserve sort of passion way. Sorry, but I think with the health startups that I've come across, they're slightly nuts on the technology sort of side. They've got some excellence, and they've got usually no business excellence at all, but they've got immense passion, and that's missing. That's all.
Good.
I think
should put here a comment. Thanks.
Any other comments? So you all agree? So it doesn't seem specific to... Yeah, can we, because of the recording, can we use the microphone?
If you may, you talked long about this IP issue. If you extend this a little bit and put the, not only the IP but also the trademark for a startup, you suggest that IP is not so important, but if this but the next thing is this a trademark thing you should be more aware of than this IP issue.
And you are right. You might say that so actually this is intellectual capital framework of the company. So you have to master everything about it. When you talk about the patents, then clearly these are here and here, and maybe know-how. So when you have the trademark, it is clearly here and here. So it's kind of the combination, and you have to have the right combination, taking into account your business model and your aspirations. So yes, the IP is here, but look at the other things. You have to be able to hire the right people. You have to motivate them. They have to have passion, as you said. It's not in the patents. So.
Yeah, another question over there to Teemu and then to the gentleman next to him. Yeah.
The slide of the pillars.
This one.
There we go. Yeah. I agree with you on those, and you know, with Andy with the passion. I think that on the top, I think that what I also gather, and a lot of people, and you see in this a lot in this space of, it doesn't matter if it's a healthcare startup or a startup in general. I think that on the top, that should be the problem. I think all these are after you define the problem. Then you start looking in these. But first you have to figure out, is there a problem I'm solving? Because I think that there's a lot of startups who are actually doing their software, doing that, you know, have these components. They don't actually have a problem that they're solving.
Yeah, absolutely. I agree.
Yeah, go ahead.
But the question is that you have to identify the problem very well and position yourself. As I said, the technology does not solve all problems of the diabetes patients. Never. It's just part of the problem. Correct. Or part of the solution.
Yeah, Erki, you said that this tax deduction could possibly sort of trigger the market. So, but in Latvia and Lithuania, this sort of incentive has been in place quite for a while. Do you see any sort of health tech startups there sort of utilizing this opportunity there?
Not really. So I cannot comment too much, but I know that, for example, Ergo, who is one of the main insurers here and there, the health insurance portfolio difference is 40 times. So there is a market. Why there is no startups, I don't know. Okay, so you know the answer.
Yeah. Anyone else? Yeah, back there.
Just my short comment about this, those pillars I see, the last one, the business excellence, is all about parts inside of system. But I think that the cultural surrounding or public opinion where all this game is going on has quite big influence. I think it should be also taken account.
Oh, this is very good comment. I think there are kind of two myths, at least in Estonia. First of all, if you are not a doctor, you shouldn't publicly talk about healthcare. Because you don't know anything about it, you don't understand it, and the healthcare clearly does not, or let's say the economic laws do not play there, and maybe even the laws of physics don't kind of work there. It's kind of, I'm a little bit exaggerating. So this is one thing, what is currently at least in Estonia. And this is very much cultivated by the insiders of the system. I think that the big hospitals figured out how to benefit from the current system in 2006 to 2008 in Estonia, and the system needs change already for 10 years, because they know how to keep the system dependent on the actions of the hospitals. I won't go into the details. And the second thing, what I think the politicians magnify. Every time when the elections come, then, and again I'm exaggerating, they say that once you get in from the doors of the hospitals, we will fix you. And there is kind of no incentive, if I believe this, to maintain my health, to manage my health, to prevent getting sick. What I told in the beginning about kind of the upcoming crisis is that when you have the solidar system, and in the solidar system you solidarily get the help if needed. But currently we are denied we don't get the help solidarily. So the queues will be longer, and we don't get treated fast enough. And this is actually an extra burden for the society, because the medical results are poorer when the diseases progress, and the rehabilitation is clearly longer if you're not able to treat the persons soon enough. So I think that the new legislation actually opens the door for the employers to start pushing for bigger maintenance of the health, or managing of the health, and bigger rehabilitation. Because clearly, as I said, the current system wants to get you fixed as cheap as possible. This is kind of what they want. But they don't care about how long will the rehabilitation take, and there might be ways how to prevent you getting sick. But no one is actually doing it here in Estonia. I don't know about the other countries. So this is the main problem. I think the technologies are there, how we all could manage our health. We could monitor our sleep, diet, heart rate, whatever. But there is no motivation, even if 1 or 5% of the population is doing it in one or another way. There is still 90-95% of the population who is not doing it. Then they don't have the support system. They have to have the support system. But kind of the politics is a little bit wrong. You have the question.
Teemu, and then Terje.
Continuing on this one, since you see a lot of startup and you're following the industry and you've been in the industry, do you see that the people are taking their own initiatives and paying out of pockets in Estonia and generally around the world to get treatment or faster?
And again, this is very country specific. I remember we had a discussion with Piret Hirv regarding term test some months ago, when you talked how the German patient never pays for certain thing that may be normal in Finland or in Estonia. And this is a kind of problematic. If I develop a gadget here that I think that is okay for people to use, then the cultural system of Germany or France or UK may be so different. They just expect that someone is paying for that.
Terje?
I think it's related, it came to my mind because of your presentation. Interesting thoughts indeed, and I would say to a large extent I agree. But I have been missing throughout the day 3 words in this presentation, and that's called digital health literacy. I would say that the health literacy as such as a principle and understanding. And in 2011, there was a Maastricht University study about the health literacy in the EU member states, which demonstrated that less than 25% of citizens have reasonably sufficient knowledge of health. And you know, the literacy, by the definition, it means that not only that you can understand what you read, but you actually apply it. And then if we add digital into it, then that comes always this understanding of what Dr. Google said. So if that would be part of it, then I think that it would be, if we would have this 70%, 75% of people having sufficient level of health literacy as it is in the Netherlands, for example, then I think we would have fully justified the right to speak about the health policy, because then we certainly know what we're talking about.
That's a good discussion point. I made 2 tests a year ago. I got my blood pressure tested, showed increased risk to hypertension. And then I made some digital tests, some genetic tests. How is my digestion working, and what are my risks of getting colorectal cancer? Okay. And I got that both of these risks are elevated. So if I go to my GP, having this digital knowledge that you say, I need some support. And I cannot get it. This is kind of the problem. It's not a question of literacy of us as patients or people, but it's the literacy of practicing medicine doctors. And I think your project that you do in the Tallinn Technical University, kind of trying to educate nurses and doctors who are already practicing, that the AI is not going to take your job away, it's going to amend it or change it. I think this is what we need in addition to kind of getting the knowledge to the people as well. And here I have an example. We all learned how to write in the school, right? With pen and pencil, with paper, and we learned how it is calligraphy, and we learned how the grammar. Now with the smartphones, we don't use the calligraphy anymore, but we use the grammar. And it didn't came like yesterday it was one and now it's another. But when you talk with the doctors today, they think that it's kind of binary event. Today I have the work and the patient, tomorrow I don't. We have to educate not only the people, but we need to educate the people who work in the medical system. They are people. Yeah. Really. Yeah.
Okay. One last question. I think you have one. No, just a comment.
Just a comment. On that occasion, in your business column is missing something related with education. Because I have my own experience, we have developed a product and realized that we are not able to go to the market without the help of GP, and as the tool is new, it's hopeless without getting help.
Say it, the education is here. And this is the outside of the technology.
Okay.
Okay, so thank you very much for an interesting presentation. Thank you for a good discussion. We have a small present for you.